I know. Just do a real quick coding. She has a real severe headache here. Yeah. Write it down.
Want me to come up
Norma,
there?
can you help me, Norma, real quickly before we start? You can get one of those and just cut it out. You're going to see an actual demonstration right now while we work because she has a severe migraine. These are 10-digit codes, Norma or Donna. You can just write them down for me. Donna, then you can just come over there and put them on. Donna, you can write these down.
Do I need paper, Vaughn? Gotta be blank.
Okay, 8-3 pattern, 9 rows deep. You got that? 8-3 pattern, 9 rows deep. 7 and 9, 9 rows deep. 9-7, 9 rows deep. 7-3 pattern, 9 rows deep. 3-7 pattern, 9 rows deep. So normally you just, there's full set pattern, so just, cut them out. Next code number is 5. And the rest 9. 5-9, 9 rows deep. 9-5, 5 rows deep. Five and 0 pattern. Go to 8-5 or 8 rows deep, 5-0 pattern. 8-0, 8 rows deep. Do you have that, Norma? Can you cut those out and bring them up as soon as you can? Also, write the 7-8. 7 rows deep. 8-7, 7 rows deep. Is your back out? A little back tired right now too back here?
A little bit.
Yeah.
Heels.
From being in heels?
My shoes are someplace.
Leave your shoes off for right now while we're still working. Do you notice that her energy pattern only came up to 42? Everyone else went up to about the 70s, 80s, and one person in the 90s. She stayed down at 40. She's blocked. So if you try treatment on her, it's not going to work because she was structurally blocked out. Did you travel in an airplane by any chance?
Mm-hmm.
Where'd you fly from?
Houston.
Houston. Okay, we'll go over these. You'll understand these codes very shortly, pretty soon. But these codes have to do with radiation toxicity. Any sore throat, fatigue after you got flying? Just you got tickle throat?
Sore throat.
Sore throat, okay. These are one of the classic symptoms of radiation toxicity. You'll understand this, sore throat, fatigue. And you're going back? Sunday. You have classic migraines? Do you have them all the time or just all the time? Okay, do you work in front of electronic instruments, things like that, computers, anything that's radiation? Constantly? All the time?
I take Discum album and
Okay.
Deliso's X-ray.
Okay, so speak a little louder. You can tell, you can.
I take Viscum album at 200C and Deliso's X-ray at 30C.
Okay, go back to Norma back there, get the code. She's going to put them on you. I'll take a photograph of you right now. So, and then you take a photograph back there.
Can you repeat what you just said? Yeah, I couldn't hear that.
Viscum album, she's taking right now Viscum album, which is
Mhm.
counter reverse spin. It's mistletoe, homeopathic, and Delicios what?
X-ray at 30C.
X-ray at 30C. Stand over there a little bit. I'm just taking a photograph of you and take it over there. We'll work over it. Healing over, that was another thing I was doing, healing over distance. Take it and then come back here as soon as she gets that ready. Here is some, okay, that was a demonstration quickly. Let's go into the seminar. Okay, are we ready for me to go ahead and put this on? I want to show you something here. This is a radiant energy device. A beeper pager is a radiant energy device. Cellular phones and batteries are radiant energy devices. If you can see auras, you will see that it shifts the aura off the field. If you douse it out, you can take someone, you can just go near it. Anything that has a battery, it resonates will blow the energy field out. So I'm going to annotate this. We'll go into this a little later on. Wristwatch, battery powered, metal around the body. Dr. Reby, I'm going to go into this history. I'll explain to you something of how this all started and where this all began, and I'll try to get in as fast as I can. I'm going to go flow real fast, so kind of bear with me a little bit. Now, putting out certain devices, most of you know there are different devices that you use on the antidote radiation. A clear way to check this would be to get someone else with a pulse and check their pulse and have them go against her. So stand up here for a second. Just you use your hand as a sensing device. You can use muscle. I can use kinesiology. I just choose to use a biofeedback rod because it's faster for me. Go put your hand closer and closer to that. Closer and closer. Okay, now let me pull one of these things off here. Here's a cellular phone.
Explain how you're reading that?
Yes, I will. Go closer, closer. Okay, from there it blows out. This is basically a fast pendulum. So now you proved my point. This is a cellular phone that has a battery on there. It was a cellular phone. Has a battery on there. Right. Nokia. And if you carry any battery devices on the body, anyone who knows kinesiology or energy medicine knows that it distorts the energy field. So basically there are different devices and different techniques to neutralize effects of radiation from batteries or any kind of electronic devices, computers, televisions, scanning devices, etc. We'll go into this. I just want to show you that there are ways, and if I'm going to wear this for the next 2.5 hours, I'd rather have something that shields my energy. So I'm going to put this on for recording purposes. Okay, so we had a little demonstration right now of energy, vital life force energy. There's a sheet in your packet there that contains a little diagnostic system that's real quick and simple. I'll go over that later, but I want to give you the history of the system first. Basically, this system of numeric prayer codes, as I call it, or the Swiss string healing system, was based on an engineer from Italy who, when I met him, was 6 years ago. He was at that time 93 years old. This engineer practiced this system for over 50 years. This system was developed when he was building bridges. This engineer had one of the highest security clearances in Switzerland. He helped build the secret installations like we have NORAD in our country here. He built the secret Swiss installations for Switzerland. This man has his degree in engineering and went to Italy to build bridges. And in Italy, he ran into a monk in one of the monasteries whose sole purpose and mission in the world was to find trees that had cancer, nodules, or dying in the forest. And he would go out in the forest and basically heal these trees. If they were small enough, he would transplant them into the monastery. As I understand it now, what he was doing was he was finding trees that were in geopathic radiant energy zones, and he was countering the negative spin that was produced by these negative energy radiant zones, or geopathic or geobiology bad energy zones, which is usually underground water, fault lines, mineral deposits, whatnot, but the cancer zone is usually underground water that produces an electromagnetic left spin. He taught, what he did was he went in the forest. If he couldn't move the trees into a safe zone in the monastery, he would take the trees and put copper coils around the trees and do the right number of coil spins. Kind of like, how would I say, he'd draw to the ground and just wrap around the tree, and he'd either dowse out or intuitively feel where he can find the balancing point by the number of coils. And at some point, the tree would resonate into a life balance or a neutral balance position. And the trees then that were dying or had these tumors or dying, they would again revive and come back to life. So this engineer asked this monk, he said to him, will this work on human beings? This particular monk said, it will work on all living creatures. And what happened at that point was that this engineer never forgot this. And at age 42 of his career, he developed a cardiac condition that he tried to spend 7 years to try to heal. It was a severe tachycardia. This tachycardia was so severe that it would drop him for 3 or 4 days, and he would have to go into the emergency room hospital. He went to the top specialists in Switzerland, France, and Italy to try to find out his problem. As we in energetic healing would probably think of this as probably maybe related to maybe a third molar wisdom tooth problem, right? You have all been educated. So anyway, at one point of his medical dismay, it got so severe that the doctors told him that he probably, the next time he entered into the hospital on an emergency basis, he probably was not going to survive. So at that point, he remembered the monk in Italy, and he decided to put some coils around his body, just like he did a tree. These coils he used an insulated telephone wire, copper wire insulated, and he used a pendulum. In the pendulum that when I met him, he used a pendulum made out of an acorn and a piece of silk thread. I still have his original pendulum that he gave me. And he resonated, and if you know that you're sick, you go counterclockwise spin, and he found out the number of coils to put on his body and for what length of time. So he wrapped and he made a little bracelet. This is why it's called the Swiss coil system. He found out the right number of patterns. He left it on. It might have been maybe, I'm guessing right now, I don't remember having my record somewhere, but it may have been like 5 wrapped coils on there for 7 days. And he switched it to then maybe 9 coils for maybe 7 days or something like that. In 14 days, to make my bottom line, 14 days, tachycardia completely gone, no problems ever since then. So what he did after that is he began to start treating animals, friends, and whatnot. And over a 50-year span of time, this man did some incredible healings for patients around the world. How he would do it is they would send him a photograph, and he would go ahead and use his intuitive approach to figure the number of coils for a number of days. I'm giving you the lineage of the evolution of this system. He would put the number of coils on for the certain number of days and then switch it as the body said and shifted the pattern. He took care of and he's treated patients in Italy.
Did you put those coils on the picture?
Yeah, no, he did not originally. He actually sent the coils to the patient's wife, would wrap them, and I would show some fishing line and wrap them, and then they would send it to him, and he'd say, wear this coil for first coil for 7 days, then switch off this one for 9 days, switch on, do this for 1 day. So you can actually muscle test this, any of you that are do muscle testing and use this original system. He did this system for about 47 years or 48 years. He became very famous. In fact, at 92 or 91, he came to the United States here and was treating some very severe AIDS and cancer patients. I asked him what his most successful cases were. He says working with children with brain tumors. He had success with this and also with children with HIV-acquired immune deficiency conditions. So those are the most successful cases that he did and most satisfying cases. In fact, he made me promise him, when I went to go see him, he died a month after I saw him. And to make a concise situation, this was kind of a mystical experience for me because my mother had breast cancer. And he had healed in this country 2 or 3 people that I cross-connected with that had cancer. And apparently, like I said, they went into remission. Let's put it that way. So anyway, I called him up, and he said, please come over to Switzerland. I made 2 contacts with him by phone. I corroborated his patients. There are 2 patients that actually I want to find out if his technique really did work. So I called him up in Switzerland, spent 2 weekends with him, learned the technique basically because I already knew. What made me really realize this man had something was because of my acupuncture background, my electroacupuncture background, but classical acupuncture pulse diagnosis. And I think Dr. Gleditch is here. Does someone here pretty good with pulse diagnosis? Anyone really good or competent in pulse diagnosis here? Okay, well, it usually takes, that's not unusual because it takes about 10 to 20 years to become a real good pulse diagnostician in Oriental medicine. And the ones that are really good are incredibly good. What I found out with this coil system, the Swiss coil system, was that when the right number of coils were put on the body, the acupuncture meridians would automatically balance by the pulses. And that's amazed me because as a child I went into dentistry because I was terrified of needles. And I went into dentistry to overcome my fear of needles, and I became an acupuncturist to overcome needles, and I actually ended up injecting myself like all of us has done in neural therapy and everything like that in just about every body part orifice that's in our body. And this is a pretty brave thing for me to do because I was really terrified. So this particular man developed a system that I was able to verify that he used over 40, 50 years. I saw the letters. He had documentation. He worked with 5 doctors. He outlived all the MDs, by the way. And one MD wrote a book on his work. He only had a chapter on his book, but he never got a chance to really publish or do any research on this. He submitted his data to the Nobel Prize Committee in Switzerland because he had political contacts through the Swiss embassy to the Swedish embassy. And his wife looked at him and said, Paolo, his name was Paolo, Dr. Paolo Ribi. His wife said to him, oh, Paolo, you're 30 years ahead of your time. They don't even know what you're doing. And he winked at me and smiled, and he said, if I get the Nobel Prize, or did he say when? Then he said to me, I want you to promise me 2 things. 1, you'll write a book, and 2, the money will go to treat children in Yugoslavia and in Africa that have AIDS. That was his wish on his deathbed. Before, I didn't know he was going to die. And I know that I was supposed to go there for a reason because 2 weeks before I came there, his wife was in Vevey in Switzerland, and a woman walked up to her and says, I know you don't know who I am, but I have a very important message for your husband. And she said, yes, what is it? She said, there is going to be a doctor coming from very far away to visit your husband. She says, please allow this doctor to spend as much time with your husband as possible. And she says, is that it? She says, yes, that's it. And then she walks off and disappears. And then 2 weeks later, I call up. I had a full practice at that time, booked up 2-3 months in advance. Here's a man from Switzerland that says, I will give you 50 years of my work if you'll come over to Switzerland next week. Now, all of you that have full practices, it's not so easy to do. And then you shut down a practice, close everything down for 2 weeks, and you know that's not easy to do either. I think the trip cost me $29,000 to go over there to learn this technique from him. When I went over there to learn the technique, I found out he had a heart attack. There was a man that had the most incredible technique in the world, and he had a heart attack, and they didn't tell me. So he's there. You can't even talk to him. He's so weak. I had to muster every skill I had to help revive this man. And in 3 days, we had him totally revived. And I spent almost 9 or 10 or 12 days straight with him, interviewing him, talking to him, and trying to get as much information as I could. Man was a beautiful, spiritual soul being. And very interesting enough, with all this knowledge and information, do you know what was a single thing that he had missed? Why he got this heart attack? Can anyone guess? Just give me 2 or 3 things. No. No. One more guess. No.
He didn't stand on one of those cubes.
No. No. Geopathic stress. Geopathic stress was what, and here was a man who dowsed, and I knew something was wrong because I knew this man had a brilliant system. Why should he get a heart attack at this point? Why should he have a heart attack at this point?
90 years old.
93? Well, I've treated a patient who's now 110 and still going. He's a sacred monk he's like the Pope in the Buddhist community. So anyway, let me share with you some of that. This was what was worth $29,000. So I always said if I can go to a seminar and learn one thing that could save a person's life, that's the price of that seminar is worth the whole trip. If I can learn one thing. I went all the way over there. I knew his system. I coded a doctor friend of mine's sister before I came here who was in a coma, and I'll share this with you, in a hospital she had a heart attack, was in a coma, was an insulin-dependent diabetic, totally unconscious. For 1 year, was treated by her sister, who was a physician MD, would not allow any nurse to do her insulin injections. She had to do it. She spent 4 hours a day for 1 year taking care of her sister who was in a coma. We coded her 1 month before I went coded for 1 month, and I went to Switzerland, forgot all about it. And in 1 month's time, her insulin levels almost came down to the point where she didn't even need insulin. She actually came out of the coma for a short period of time and acknowledged her sister. This is to her miraculous because she said, how do you know it wasn't anything? She said, it had to be the coding system because we changed nothing else. So we were able to modify insulin levels with this coding system. I'm in Switzerland now. I'm dealing with a man who basically almost died from a heart attack. The doctor, in fact, when 3 days we revived him with his coding system and moving him around his geopathic stress zone, in 3 days he was up and around talking and back to well. And his physician could not even believe it. Could not believe it. They did not tell me he had a heart attack because they were afraid that if they told me, I wouldn't have showed up, and I probably wouldn't have gone. And then you would not be hearing this information today. That's how fate works. So what happened was that the geopathic stress, how he fooled them. This man's a brilliant man. His son told me, and this was the key, his son told me, my father was the most brilliant, the most energetic, the most vivacious, the most incredible soul being until he moved into a new place 3-4 years ago. Aha, geopathic stress. I went to check his bedroom. I couldn't find anything wrong. So then at that point what I did was I said, something's not right here. I know something's not right. So then I laid his wife in her side of the bed, and I felt the pulses. This is the acupuncture. And her pulses, I put her on balance with the codes, check the pulses. This is how I do check geopathic stress over distance. And then I moved her to his side of the bed and checked the pulses. On his side of the bed, her pulses just blew out. Move her back to his side of the bed. But then I went and doused the bed, and I couldn't find anything wrong with his bed. And I said, what is going on here? And yet when I moved her back and forth, she blew out on his side, but not on her side. And she told me, I checked the scan of the room, and there was one place in the room, I said, this is a real bad zone. She says, yeah, we can't put any living plant there. They all die. So I said to her, did your husband do something to his bed? And she said, yeah. I said, what? And she said, he put a copper coil around the bed. And I said, do you mind if I cut this copper coil? She says, please. I cut the copper coil, and lo and behold, I could douse out, just general straight dowsing, and pick up the geopathic stress zone that cut right through his whole body on just his side of the bed. He fooled himself with the copper coil. He fooled his body system. The body system was still in a bad energy zone, and he fooled himself because he couldn't read it with his dowsing pendulum device. We have to be aware of this, that we can fool ourselves sometimes in our measurement systems by sometimes masking certain bad energy systems. So that lesson was worth for me $29,000. Maybe not to you, but to me it was, because we moved him out of that bad energy zone, and in 3 days with a coding system we had him almost recovered to the point where his cardiac physician could not even believe the recovery, and I was able to get the information from him.
So there's nothing you can do in terms for geopathic stress?
They always say the best thing to do is to move out of the bad energy zone. You can try all kind of devices, but there are some things you can shield yourself and neutralize, but really bad energy zones, you have to move. That's my basic feeling.
So what did him in?
Being in the bad energy zone there,
Well, he couldn't bounce back.
he did bounce back. He bounced back so in 30 days, but he was healthy when he passed. In fact, the woman, he got to know the woman that met his wife. Very interesting. He was so healthy that he met her at 7 in the evening, and they talked till 3 in the morning. He gave his whole life story to her. Sometimes they say this happens. And at 3 in the morning, he says, excuse me, but he says, I'm a little tired. He says, do you mind if I retire now? He says, I would like to go talk to God. And she says, yes, please. And at 6 o'clock in the morning, his wife found, and he just left. Now, I'll go to even a more interesting story on this, is that from that point forth, I had actually 2 communications with him through my patients who were clairvoyant. So one was in Austria, and one was actually here in this country, in my dental office. And so I know there's an article in People magazine about a clairvoyant that I know by the name of James Van Prague, who's on the Oprah Winfrey Show, was on a couple of programs here, and he has the #1 book, like Talking to Heaven right now. And I know several dear friends of mine that are healers that help people when someone's passed over to the other side to let them know that everything is okay. And I know that part of this information of the evolution that I'm going to share with you tonight is based on Dr. Reby staying around in the lower dimension and assisting and feeding information, because I would be woken up at 4:30 in the morning and I am a sound sleeper. And I would get information on the evolution of the system. Now, the system that he learned with the coils evolved to a point where he was able to say, instead of wrapping copper coils around the body, that you can substitute numerology or numbers for it. So instead of 4 coil wraps, you can put the number 4 on a photograph or on the body field. And this process, now he didn't know what he was doing. He didn't know anything about acupuncture. He didn't know anything about physics. He didn't know anything that's going on right now. So I asked him, where do you think this all came from on the coils? And he said to me that the physician, the monk in Italy went to a lecture in France. And this is, I believe, the lecture that he went to. The book is called The Secret of Life, Electricity, Radiation, and Your Body by George Lakowski. In 1925, Lakowski went to France, and I'm not sure where Lakowski is from, but he went to France to give a lecture before the medical profession on treatment of cancer patients by putting copper coils around.
What's the name of the author?
Lakowski, L-A-K-H-O-V-S-K-Y, The Secret of Life. And it's by Noontime Press. And here is a picture, actually, of Lakowski. He did the Lakowski coil and different items. But here is a picture of plants that he treated with the same coil system, showing that he was able to take the plant, wrap the right number of coils around that plant. And he talked about also cancer in this book also. So this is where I believe the monk learned about treating the trees in the forest. Okay, I'm trying to give you a historical basis for the system.
Books in print.
Books in print, yes, it is in print. I was for a while. This is the new printing, right? Because I had the old printing. Okay, so now from this process of learning, what I want to go over right now is basically the numerical meanings of the numbers. He made the transition, and his son was an engineer. When his son could understand the coils, because that's an engineering principle. You know, it's like that thing that goes like this. I can't remember, where you see field and everything like that. But when his father made the transition from coils to numbers, his son could not believe his father anymore, even though his patients from all over the world sent him. I read the letters. By the way, this man, 2 years before I met him, destroyed 50 years of his research. Destroyed 50 years of his research. He kept some of the radiographs, and he also kept some of the letters from all the patients. But he basically came under assault for his work. That's why I myself was very reticent to talk with you as a group about this process until I knew that we could have a protective shield under research guidelines. Also, too, I also feel that prayer is something that is universal, and one of the things that I have found that's been very effective when we treat patients in hospitals in this particular system is that this system placed on the body, sometimes we don't use a photograph as an energy medium, but we actually use a body with maybe the bed gown. We've saved the 2 lives that were saved on this, that the first 2 lives I saved were both on a Friday afternoon. 2 mothers, friends of mine that I knew, one mother actually had a bacterial infection, systemic, could not be treated in the hospital, was given 12 hours to live. The second woman was a woman who had a stroke in Austria and also given less than 12 hours to live, diagnosed by 5 physicians, including the family physician, saying no chance to live. By the way, this was the same situation I think that our dear friend Ed here went through with his stroke. The doctors gave Ed no chance to live. In treating these patients on the Friday afternoon, we did the codes over the phone, right directly to the hospital, and we said, if there are any questions, if the doctor asks you, what are you doing, just say, these are prayer codes. The doctors all just scoffed, they laughed, they went to the coffee room with the nurses, and they thought it was crazy. But the woman that had the stroke, as soon as the prayer codes were put in, within 5 hours of the placement of the codes, that woman actually sat up in bed, moved her hands, was able to talk. The other woman who had basically a bacterial infection of the pancreas, of all places. And the hospital did not even know where the infection came from. I said, it's in the pelvic region. That's where the bacterial infection is. The codes will give you that actually if it's bacterial, viral, fungal, parasitic. So in the pelvic region, that woman within 3 or 4 hours completely stabilized, was sitting up and actually walking around. These were given 12 hours. They told them, go call the family. These women are dying. The first life that this system in my hands saved was the life of a cat, Keisha the cat. On a Sunday afternoon, a friend of mine came and said, my cat has a viral infection in the heart. I'm afraid she's going to die. They've given her 1 to 2 days to live. Can you do anything? My answer always in this case is just like Dr. Q now would say when he said his talk was, what do we have to lose? Let's try. On this cat situation, he went to the top homeopathic vet in our valley, who I know is a wonderful, John Limos is a wonderful physician. He diagnosed it, viral infection in the heart. One coating on Sunday, the cat was so ill that it couldn't even get out of the litter box to pee, eat, or anything. It was dying. The next day, that cat was bounding out in the backyard, jumping around, and it's still alive today. That was the first life it saved. Okay, I get a Christmas card every year from the cat. Seriously, seriously. Okay, so this was the demonstration of the system. I knew it worked. I wanted to know, how does it work? How does this system work? And that's where I started to do the research into understanding why. And I'm trying to give you some of the research data on how this, there's some doctors in the group, some very educated people here, and I want to try to give some theories and postulates of how this system works. I know it works. We had the demonstration here when I gave the hour talk last year, and some of you were here, of one of our members of our group had a heart attack out in the lobby of this hotel. She was in the lobby in that chair. How many were here at that time? Were any of you out there that did the coding? There were 2 or 3 physicians with me there, and also Mrs. Issels was there, and Dr. Issels was there watching. Do you remember we were out there? Yes, we were there. And this particular woman, who I thought was going to be at the seminar today, had already 2 previous heart attacks. Same type of prodromal type syndrome. She'd get a crushing pain across the front part of the teeth here, and pain radiating down the arm. Each time was a 7-day stay, another was a 10-day stay in the hospital. What? 10-day, 7-day stay. Her medical bill, because she did not have medical insurance, was over $200,000. Okay? She said at 8:30 in the morning she had the same symptoms when she got up. She tried to ride it out. She tried to come down the seminar. I think it was about 10:30 or so. We were taking a break. I can't remember, around 10:30, 11. Someone called. I gave just my talk, and someone says, Dr. Harada, can you come out there? I think Christine is real sick or she's having a heart attack. She sprawled out there, got 2 doctors with me, and I said, you write, you this. And we just coded right there. And I just happened to take her picture the day before because I knew that she was ill from her heart attacks, and she's a dear friend. And she was already losing consciousness. She was already losing consciousness. Within 3 to 5 minutes of the code placement, was anyone there? Was anyone physically there? How long did, you were there, right? You were witness.
I was writing the code.
You were writing the codes. Oh, thank you. I want to know who wrote the codes that time.
I saw her actually going from totally white
Yes.
to having more energy and more color, and
She was delirious at that point. Well, she was actually getting ready to lose consciousness. Were you there? Were you there? In about 3 to 5 minutes after the code placement that we placed on there, she revived and she actually stood up. And I thought to myself, oh my God, you better sit down. You know. She stood up and she said, I feel fine. I feel fine. Right? Right. I had someone in the news media there. They said, can we take a press? I said, please, no. Please, no. I don't want any publicity on this. She came in the room afterwards and she gave her experience to the story. There were actually 3 cases of a heart attack that I treated. And each of these cases, the brilliance of Dr. Vole came to me. Dr. Vole, Dr. Koo, my mentor teachers in energetic medicine, said many heart attacks occur because of a viral insult that short circuits the nervous conduction system of the heart, causing the heart to go into fibrillation, and the clot forms afterwards, not as a count of because of the heart, it forms after the fact. In the 3 cases of heart attack that I treated, She was one. I had two others. One case was in Austria of a woman who was the mother who almost died in Austria that recovered. By the way, these two women who were supposed to be dead in 12 hours, the one with the pancreatic bacterial infection walked out of the hospital in 7 days on her own, is still alive today and is completely fine. The other mother walked out of the hospital with a stroke in 10 days, completely fine. And I really feel that if a stroke case can be treated in the first 24 hours to get oxygen into the system and circulation back in, full recovery is possible. Now, this work has been proven out by the German doctors that are doing ozone therapy right now. There's one that has treated over 60 cases of stroke. If treated within the first 24 hours, the use of oxygen therapy will, every case fully recovered. Every case fully recovered. I'd love to do a research project right now because one of our research universities did the research on ozone here in the United States. I'd love to see this research done under an umbrella of protection through the research group. And I have research group right here. Any of you interested in research, I have the papers of the group that we're working with, Stony Brook University and New York Medical School and the Cancer Center in New York. We have a team of doctors that are pro-advocacy for the work that we do, ready to go ahead, and I'm waiting for funding right now. We've had initial input, the funding up to the tune of $9 million is coming in. So we're going to start setting up programs. I want to set up the academy as one of the education wings to disseminate information to doctors and to set up protective umbrella. I've even talked to Dr. Kunow. We've discussed about setting up a research teaching center. And Dr. Kunow is dreaming to set one up in Baja Mar in Mexico. He'd also like to do work with actually growing sharks and cultivating the embryos so that the sharks do not have to, they're just killed and thrown away anyway by the fishermen anyway. Isn't that true, Dr. Kunow? You would like to do this research, yes? Okay.
We know intravenous vitamin C will reverse a stroke in front of your eye.
Yes. Yeah, I mean, these things, but we can't do them in this country, yes? So we need to set the stage to begin to start doing some of this work.
Now we can tell people what you're doing. You can't
Okay. Another testimony, I didn't hear that. Another testimonial that I want to go with Ed's case is that Ed was in the hospital and they had to sneak homeopathic remedies into the hospital, and they had to sneak medications like IVC into Ed. And Ed, of course, was given no chance to live, yes? By the doctors. No chance to live. And yet they built up a bill of over $200,000. Yes? Fortunately, we had set up an umbrella of protection for Ed Carroll by putting Ed into a trust. And I hope a lot of you take a little heed from this. The trust was done to protect him from medical onslaught. But in this case, it was a medical onslaught. And so anyway, from the point of reference of how it affected Ed, when I got called on the case of Ed's case, and Norma or Carol can verify this, we were talking about this morning, Ed had, after the post-stroke syndrome, he had hiccups that were so bad and violent for 4 days. Carol or Norma? We're talking about the episodic hiccups, I mean the violent hiccups that Ed had for 4 days.
Oh, for sure. You called and I didn't know what we were doing, but anyway, I wrote him down as you said, and it was 12 digits, so it was real critical.
Ed was critical.
And I wrote him out, just like you said, and nailed him onto his shirt with tape. And so the hiccups stopped that night. And then the next night we coded again, but I didn't know, I couldn't, well anyway, it was awkward. I wasn't writing down and trying to keep him upright, but it didn't work. So I didn't have the codes right, as you said.
Yes.
He did have some hiccups that night, and then the next night we coded again, and by that time I knew how to do it, and he hasn't had hiccups since then.
Now the danger of what they would normally do in a medical situation would be to maybe give him a sedative, in which case, in a situation like that, it could have taken Ed over. It could have taken, I mean, because of his condition, okay? And one of the things we have to learn from the coding system that's so brilliant from it is that it could give you a baseline of stress pattern of the patient. Ed was going through hyperbaric oxygen at one point. And all of a sudden, and Ed was saying to Carol, you know, I don't want to, what did he say? I don't want to do this, or he was, and it was getting to be, I think he was getting to be on 10-digit or 12-digit codes. Now there's a pattern, I call it the human life resonance spectrum of the codes. on the string codes is 8 digits, 10 digits, and 12 digits on a binary system. 8 digits is stress, feeling bad. 10 digits, acute stress. 12 digits, life and death stress. If 12-digit codes come up, like a dear friend of mine about a month or 2 months ago, I jump out of bed and I'll go to that person, because 12-digit codes means he's going to the hospital. He could go over and die. So Ed was on a 12-digit code pattern. I said, Carol, stop the treatment immediately. Listen to Ed. Ed's right. If you force him into something, it's going to stress him to the point where you can trigger an acute cardiac arrest. Okay? So this process of coding also gives you the stress pattern to tell you what stage the patient is in their recovery process. Now, I have coded 5 or 6 people here. And we just did this as a demo, because I can't do it for everyone. But I'll just go over one person right now, and that's Dr. Ted Hamway. Yes, right here. Stand up for a second. Okay, Ted said, I have a problem with my left knee.
No,
Yeah? Right knee, right knee. What is the problem?
It was stiff.
Okay, you've had this for how long?
About 4 days.
4 days. Okay, I did some code patterns on Ted here, and these code patterns were 10-digit codes, which means he is under moderate to severe stress right now. Not life and death, but I know that he's not healthy, he's not comfortable. And I found out that by the coding codes on there, and I'll show you this, we're going to go over this, the numeric 7 means kidney. Kidney rules bone in acupuncture. So I found out that he had weak kidney energy. He also had, which was efficiency of 12% efficiency in the kidney. His heart efficiency was 22%, and his vascular blockade was 62%. That means he has arteriosclerosis. And some complications as a sequelae of that. And also he has 92% problem teeth stress in his teeth. These are from the codes. Now then he comes up to me after today, and we're just talking right now, and what do you tell us what happened? Just
I have hypertension.
right. Vascular problem. And you have dental foci.
Right.
Okay, dental foci. And about the knee. The knee.
The knee's better.
Okay. What and how is it better?
It's considerably better.
Okay.
You know, I could contract it without feeling any tightness or stiffness.
And this was at lunchtime when we coded right before lunchtime, yes? About 10 or 11?
Right.
Okay. Now, 10-digit codes, if he goes well, by tomorrow he'll go on 8-digit codes, and he'll even be even better. That's just a demo of that. Anybody else that I worked on has any shift or changes? Yes.
I've chronic back problems for years, and we were sitting at lunch, and I told my wife, I said, something's going on with my back because I can take a deep breath. But my back's been in spasm for the last couple of days. I hadn't been able to take
Speak up louder.
I said my back's been in spasm for the last couple of days, and I hadn't even been able to take a deep breath because of the pain. And we were sitting at lunch, and I told her something's going on with my back. I said, Harada's working on me somehow because I can breathe.
But that was the beer you had.
No, I can't give you the credit.
Well, we always have someone that throws a boomerang in there. But you could breathe, yes? How much better is your back problem right now?
I couldn't have done that today at all.
Okay. All right.
Bob Jones, we've been treating each other for the last 2 days. 'Cause our
Okay.
backs are bad.
Okay, thank you. Thank you. And I'll tell you something. I'll tell you something very interesting. About 2 or 3 meetings ago, I came to this meeting and almost had a heart attack. Okay, myself. And I had Dietrich treat me, and I think maybe Doug might have done some. There were 2 or 3 people that treated me just to stabilize me. I could feel the chest pains. I could feel the tightness. I could feel also the premonition of death in my body. And I knew what this was from. In Malibu, where I lived in Point Dume, there we had a major flood in 1992, and the Las Virgenes Water District was dumping chloramine T besides chlorine into the water system. I could smell it out of the toilet bowl. I was being chemically poisoned. The chemical poison then triggered a viral infection. You're going to find the code number 6. signifies a viral infection or a chemical poisoning or chemical entity. Which is so interesting is when I went to the Webster's Dictionary, the first thing it said, it defined a virus in normal way as a DNA particle, RNA particle, et cetera, but it said the second definition of virus was a chemical entity. The code symptoms for virus and chemical entity are the code number 6 are one and the same, and Webster's Dictionary just put it right together right there for me. So at that time I didn't know the coding system. I knew Dr. Vole, what he taught me, what Dr. Bill Koo taught me. I went to my nosodes, went through all the Coxsackie viruses. I think found Coxsackie H7 or something like that in the Stop Pharma remedies, doused out the specific remedy that I knew I needed, pulled it out of the bottle, gave myself an injection. In 10 minutes, my heart conditions were completely gone. My heart attack syndrome, pre-heart attack syndrome was completely gone. Now, I had a homeopathic dear friend of mine from Belgium who, if I had known that he was having a heart attack, he was having a heart attack, chest pains, being a homeopath, he's going through his materia medica. His wife says, please let me call 911. No. He says, I'll find the right remedy. He spent 2 hours trying to find that remedy and ended up dying because he couldn't find the remedy. One call, boom. All you have to do is be on the right frequency and boom, it clears. That's all we need to do. And there's many ways to skin a cat. So I've lived part of this process in terms of what we're talking healing. We're going to call on some of these other people later because I did about 3 or 4 other people. This is 2 for 2, so that's pretty good so far. Is there anyone else here that had a shoulder problem? I think there are a couple of shoulder problems. Yes.
Yeah, I can't feel it anymore. I've had a chronic tenderness in that one shoulder.
That one point, that hip point right there.
Right, yeah.
Now I'm going to, what's your name, please?
Malena?
What?
Malena?
Malena. Let me see. I think you wrote your name down here.
No, you didn't take a picture.
Oh, I didn't take a picture. Okay. You have your codes. From that coding pattern, we could see a process on the physical. The coding system works on multi-dimensions. Physical, mental, emotional, and spirit or spiritual. It covers a multi-dimensional realm of treatment when you do this work. Okay? Is it completely gone?
Yeah, I mean, I can't.
I mean, you've been suffering this pain for chronically for how long?
Over a year.
Over a year. Okay. Did I tell you anything about the codes when they came up? Did I say anything on what levels they were working on? I'll go over this and you'll see. You'll be able to figure out your own pattern. Okay, that's 3 for 3 now. Where's the next person? I have to have some failure here, don't I? Yes.
Yeah, I had a shoulder problem too, my left shoulder.
Yes.
It's a lot better.
About 50, 60, 70% better?
No, I'd say about 90% better.
About 90% better. Great. I think you were on 10-digit. Everyone else had 10-digit codes except for one woman whose wife right here, you were on 8-digit codes. Any change in your back? Stand up and move. Yeah, move. She was the best of the whole group, by the way. She was on 8-digit codes, which means a normal stress pattern stressed out to that.
No, like, go to here.
Still there, yeah? And you've had this chronically for a long time.
About a year.
Okay. About a year. And if I'm not mistaken, major situation that you have on there is on an unconscious level fear. Fear.
Well, you get nervous when nothing gets better and you've tried a lot.
Yeah. And the fear is what's freezing and holding you from progressing. So we'll see how you do tomorrow. Because sometimes it takes 12 to 24 hours to get a correction in a pattern, and then we shift the codes to the next day. But emotions are such powerful entities to block healing. And I'm going to go over the patterns for conscious, unconscious, subconscious levels. And then we also have an area what we call almost past life, miasmatic, etc. I'm going to put the sheet up there for that right now. So we're going to do a little slides right now and go into that. Was there anyone else? Was that it? Yes.
I have a shoulder problem, been there for about 6 months or longer. It's about 50% better.
About 50% better. You had that one where you couldn't lift it. You're moving it pretty good rotation now? Good. Okay. So that's just from what this morning, right? So theoretically, 3 completely gone, 1 50% better, and 1 still stiff. Yes? Still stiff and tight. Not totally. Okay, but that's not too bad, just for a demo, just to see what's going on. Okay, let's do some slides right now. Now, I'm going to go ahead and... You have some material. I've given you quite a bit of material in your... Let's see, where is...
How did you get these numbers?
What?
Did you use your raw?
Yes, I'd use the dowsing rod. Yes.
Are we
I don't know how to-
Are we missing something? I mean, I'm hearing what you're saying,
Yes.
but I'm not able to put any of this together.
Will it start to
Yeah,
come together?
yeah. Let me go ahead and go over the slides. Okay. Let me get some information here. Basically, the first sheet on the slide here that you have is your sheet. And the reason why this slide was so important, and I want to read you the section in that section of that I thought was the most important. Then you can just... Okay, on the far right-hand section that I have kind of delineated right here. Can you see that? The picture is really valuable because it talks about the sine wave and it talks about these coils. The string theory of physics is on this sheet right here. The one that's the LA Times article right here. Okay, you have it on the second page. This is Strohmeyer, I think, from UC Santa Barbara, is one of the major proponents of the string theory. The string theory of physics, or the string theory itself, is to me the most brilliant form of what I call the combining of both math and physics into a harmonic or a single point. And the string theory says that according to the string theory, the fundamental building blocks of the universe are not particles or forces, but tiny loops that vibrate in 10 dimensions, just as a 4-string violin creates symphonies of sound. The harmonics of the higher dimensional strings create everything in the universe. For the first time, it brought physics and math together. We have little strings or coils on which numbers or numerics are positioned. So it brought for the first time, the mathematicians said the universe is created by mathematic numbers. The physicists say no, it's waves or particles. We have actually now the formulation of a theory that combines both numerics and form. This book, this picture writer is taken from the book called Awakening to Zero Point. The author is by the name of Greg Braden, B-R-A-D-E-N. This is a brilliant book on explaining healing in physics, because what they go into in there, so now I'll read it. There's one, Greg Braden, G-R-E-G-G-B-R-A-D-E-N, Awakening to Zero Point is where I took this from, and I give him credit. Greg, G-R-E-G-G, Braden, B-R-A-D-E-N, Awakening to Zero Point, and it's the ordering is so Sacred Spaces, HC81 Box 683, Cuesta, Q-U-E-S-T-A, New Mexico, 87556. Brilliant, brilliant. I could recommend this to everyone because I feel that that's what we're doing. We resonate the string codes. We want to get the person into a neutral point, 0 point positioning or balance. This is the book here. I'll pass this book and you can just read it. Okay, now let me read to you the section in that book and the portions that I think are significant to explain. I'm going to go into the physics of this now. Okay, on this page right here, follow me as I read. Within the context of third-dimensional experience, the energy of light exists as two separate, though related waves. The two distinct components function together to provide the physical expression or more subtle aspects of the creative matrix, the electrical field and the magnetic field. When considered together, the two components provide a single field known in Western thought as electromagnetic energy, expressed as a wave. Without exception, all physical matter may be viewed as an expression of electromagnetic fields of energy or light. Now I feel what the code systems do is bring light into the energetic body. This is the understanding on that level of physics, electromagnetic and the light information. This is a critical aspect of this particular slide right here. This next slide just basically goes into the creation, the sacred circle, or the 0 point, is where consciousness begins. This point here basically is showing the expression of consciousness. You can get into physics. More importantly, on this particular section is a section about 3 or 4 pages down that life is composed of a binary system, because the coding system will include basically a system of balancing 2 numbers, always 2 numbers, or a 0 in terms of the life force balancing to create resonance. So this basically shows how consciousness, and it's an interesting, this is getting into the esoterics, but at least the formation of consciousness where 2 circles come together, and then we go into multiple circles coming together like this, and then we go into actually the creation of what they call the flower of life right here. This particular symbol has a culmination of form and field and energy into it, and you can use for healing purposes. In fact, I have on the back of my watch a form field right here of the flower of life. These little form fields or mandalas can be placed on electronic devices, plugs and whatnot, and one of my friends from Sony Studios made up a specific mandala that I'll go into called Heaven and Earth Mandala that actually antidotes the effects of radiation. She's around computer screens all the time. And she made up a little kit there, and for a $5 donation or something like that, you can stick them on either your body, you can put them on your electronic devices, computers. Watches, I'm not so sure, because you might want to put it on the back. Yeah, there are many different systems out. There's one of these devices right here that was produced by the Aegis company out of San Diego that we used to put on computers. Yeah. And this one, you can dials out, you feel the negative energy field about 1.5 feet away, but when I put this one on, it completely clears it. This one I found to be very, very effective for antidoting radiation. When you fly or anything like that, very effective for cellular telephones, whatnot. We can actually code a phone. I have my beeper pagers and cellular phones coded right now to de-resonate the electromagnetic radiant energy from there. So you can have a code for anything. This falls into the realm of radionics sometimes. Do all of you know what radionics or radiesthesia is? It's a form of resonant healing using numbers, okay? But I want to get into the actual physics, like to explain that there is a theoretical basis to explain how this works. Getting into, again, the same area of the binary system of life, how mitotic cell division starts from 1 goes to 2 to 3 to 4 to 8 to 16. Human life, adult life, resonates between 8 and 12-digit codes. I had some people go to 14. That's extreme stress. That means 14 lines in each line. You're seeing the patterns here. That is almost like checking out of the body. Okay? So, and at 16, I'm sure you're out of the body. And that vibratory resonant field. Children resonate at a different level of codes. So, okay, that you can follow. Now we're going to go on to the meaning of the numbers. Right here. And this is where it gets kind of interesting, because numbers have significance. Numbers are living entities. They carry vibration, and they carry light, and they carry frequency. Okay, can you read that? The number 1 is consciousness, mind, thought, the single unit, the monad. Number 2, and this is what this particular system, because this system is balancing stress. Now, there's a difference between numerology and what we're doing here. There is a difference. Yes, you have this overhead. Everything that I'm doing for it, you have in your book. 2 represents kind of like the nervous system. It's like consciousness. After you have pure consciousness, then it goes into physical consciousness, which is the nerves. Okay? Now, if you want to look at this, and I don't have this picture in your mind, it also from the body down, the number 1 represents crown chakra. Number 2, maybe the brain. in the head area, 3, chest, 4, lower abdominal region, 5, stomach, spleen, pancreas, 6, reproductive nerve plexuses, the major nerve plexuses in the pelvic region, 7 would be the knees, and 8 would be the feet. I don't have that picture, but I just give you, there is a progression of top down on the numerals representing the human body. 1, consciousness. 2, brain, head, nose, teeth, jaw, head area. 3, from maybe the throat down to the lung area and heart. It covers the lung, heart. 4 is intestinal, lower intestinal bowel system. 5, stomach, spleen, pancreas area, heart also. 6, lower pelvic nerve plexus. 7, the knees, and 8, the feet area. And the number 9 represents the auric or etheric field, and 0 represents void or consciousness. So we go all the way to 0. They go to number 3. The number 3 represents, and these are the stress patterns that show up when we code someone. 3 represents large intestine, small intestine, or excuse me, liver and gallbladder energies and lung. So number 3 represents also in the numerics also parasites. Okay? Parasitic frequency field for 3. The number 4, and there are emotional components tied to these organs, just like in Oriental medicine or other symbolisms. So if a person has gallbladder, they're holding tremendous amount of rage. Liver is anger, okay? So if someone has liver disease, then you know they're carrying the emotion of anger. 5, I gave 4 already. No, 4 is large intestine and small intestine, intestinal system. And 4 represents fungus and heavy metal toxicity in terms of numerics on there, okay? Number 5 represents bacteria, and 5 has the most organ systems tied to it. It's right in the middle. It covers the area of stomach, spleen, pancreas, heart, lymphatic, and skin. Okay? That's code number 5, okay? Code number 6 represents virus, or remember I said chemical entity, and that's in the Webster's Dictionary. Considers the nerve plexus and conduction system in the lower pelvic region. 7 would be kidney, bladder, and sexual organs. Kidney also rules the bone also. Kidney rules bone, structure, and joints. So structural problems, neck aches, back aches, the joint, everyone that had a joint problem here had the number 7 as one of their code patterns in the binary system. Number 8 is blocked circulation, chi energy, blocked chi energy flow, financial block, financial stress, worry, blocked authority or power. 8 is the infinity sign of energy movement. When that shows up, there's a block in that movement that represents a lot of times to financial situations. I'm going to give you a code tonight that'll be probably the most valuable code you get here. It's an abundance code. And I'll give that to you, and I'll tell you something, it does work. So, you have it in your chart there. We'll go over it. I'll come into it. We'll come into it. Let me finish what I'm doing here. Everybody needs an abundance code. It doesn't always necessarily mean money. One person got a house from it. Another person in 3 days had 3 multi-million-dollar deals come right on his table. Okay, number 9. You take what? I didn't hear that. I need a good laugh.
You take door number 2.
Okay, number 9. The number 9 pattern comes up is involved in the area of stress of the astral, the auric, the etheric field, the energy field around the body, spirit world intrusion or spirit, spelling error there, spirit entity stress, inherited weakness, and miasm. It'd be like when that number comes up, it could be considered a genetic miasm or something like that. It's in the energy field, in the memory of the energy field, stressing the system. Okay, and the 0 is the void, potential, unconsciousness, preconscious, before entering into the physical world. This is what we call the void, dark, preconsciousness or whatnot. The number 0 is I can't remember when the 0 came into mathematics, but it's a very historically significant event. Because at one time I was studying mathematics, they were saying, okay, now, Now we're going to go into the binary system and give you some examples of what these numbers mean. Now Dr. Reby, when he went from using coil bands around the body, which is a valid technique, those of you who think muscle tests or do dowsing, you can actually do this, went then to putting the numbers on the photographs, and that's when he lost his son. His son no longer could believe that his father, he thought his father went off the deep end at that point, because the son was also an engineer also. And so at that point he said, my dad's lost it, okay? Dr. Reby used a binary system of 2 numbers. And he used a pattern of 2 numbers, including he found a 4-number pattern, which he called the universal balancing pattern. And you can actually take this pattern and balance the acupuncture meridians without sticking a single needle into the body. Amazing, amazing demonstration. Okay, now we get into the patterns. Yes?
These basic numbers, they all represent a problem or something that
They represent a stress in the body that's showing up, yes. This is not numerology in the sense of the word. This is a system based on stress factors related to patterns. So when these numbers show up, that means you have this stress in some part of the energy field of the body.
no stress would be what number?
Clear. You would be totally neutral. You couldn't pick up any distortion, either left or right field spin, almost a clear energy field, or neutral energy field. Balance, we call it 0 point if you want to look at it that way. Be no stress.
You're going to get into how to determine this? Because I don't have a clue as to how you determine it.
Well, what we're going to do is basically, as late, this is a first-time course of introduction. My experience on dowsing is based on 25 years of electroacupuncture skills. So I've layered this knowledge over many, many years. You can take a certain condition, for example, if you have a joint pain, and this is what this is going to show, you can put those numbers on and play with them. And try to see if it doesn't help your joint pain or help whatever pain you have, and I'll give you some codes if you have a specific pain to see what you... I got to take you, what I just did right now is an advanced system that evolved over 6 years. I can't expect you to do this system right now. I'm trying to give an introduction. People ask me, how did this happen? How did it evolve? I'm trying to give you a way of doing it. I'm going to give you a simplistic way of the system that Reby developed that you can use for yourself when you go home today.
Yeah, what you're telling me is you're giving me those codes, and I blindly put the code down for whatever matches that thing.
Yeah, if you have
I don't
the...
determine it from the patient.
You can if you have the skills. Do you muscle test?
Yes.
Okay, you can muscle test. If you put the right codes on, therapy localize a point like I did on her hip, her shoulder point here, she's weak. Then I put up codes on, I put the 7, 8, 8, and 7 were structural codes, and then all of a sudden she's still weak. I keep finding codes until all of a sudden she goes strong. And then I found the pattern that opened up that energy block. That's as simple as I can tell you what I did. You can do the same thing with a no-sode. I took Dr. Abraham, Alona Abraham, who I thought was going to be at this group because she would verify. She had a dental focus on one of her patients or herself. I know it was on a patient. I think it was a retromolar space focus. So she's trying to find no-sodes that she says, I can't quite get it to balance. I said, you want it to balance? I said, yeah. So I just therapy localized the point, like muscle testing, figured out, asked the body what codes were needed on there. Usually for dental bone stuff, it's 5, 7, and 5, 8 patterns. 5, 7, 7, 5 reverse, 5, 8, 8, 5 reverse. That's usually either a bacterial infection, which would be a focus, or an allergy. Okay? So I dowsed out her therapy localized till the area got strong, and I had the codes on a piece of paper. I put it on her honeycomb of her Computron. She tests. She says, I don't believe it. I can't. It's balanced. I said, of course. I mean, to me, it's real simple. But there's someone else who doesn't understand. They said, how could that be? I couldn't even balance it because she didn't have all the no-sodes. And no-sodes are very specific. Classic radionic therapy is very specific. You have to have the right code to balance energy. This system is terrain balancing. We're doing an energetic terrain. I've never seen a system like this in all my studies, and if anyone else has seen a system like this, please tell me, in the world. I've never seen this type of binary system used in healing, and I've looked as many. Has anyone else seen a system like this in healing, a binary system like this in numerics? If you have, I'd be very interested because I'd like to see the data or information on there. Okay, now, so let's go over some of the code patterns. Did I answer your question? How you can?
Yeah.
Okay, because if anyone asks a question, ask me, and I got to run a time frame, so let me Does anyone want to take a break right now? You want to roll? Roll? Okay, let's rock and roll. Okay. These are the most common patterns that I found for healing conditions in the body.
Vaughn, I have a question.
Yes.
With the dental infections, since that's so important.
Yes.
You said 57, 58. Could it also be 75?
There's always usually both patterns show up. You have to go the left side and the right side of the field. You have to create, for energy to flow, it's like you have to have the yin and the yang. You have to have the male, the female. You have to have the positive and the negative. One is reverse, positive, and negative. You have to have the polarity to get energy flow existent. I'll tell you something very interesting. I became very famous as a dentist in Beverly Hills for treating patients and doing complete bone cavitation surgeries with no antibiotics. Never have to use an antibiotic. Never. I would do the same the Germans would use no-sodes every day. You take our classic teachers, Kramer, Turk, Joachim Thompson, and they were our mentor teachers in the biological dental field. And when they did their surgeries, they brought the patient in every day, 7 days to 14 days post-surgery, balanced out the acupuncture reading with what? With no-sodes. Every day. That's how I used to do it. I have about $10,000 in Stoffen Pharma no-sodes somewhere in my garage. One of the things I want to share with you on this is why this is so important for me. I got very much into computerized homeopathy. I saw the brilliance and the power of computers. My astrological chart says that I abhor computers and electronic things like that, and I kind of do. I resisted this in my practice, and I had a very successful practice because I saw the downfall and the weak side of computers. The power is there. The problem is I was planning a trip to go visit a shaman medicine man in Peru in 12 hours in the jungle of Peru a year and a half ago. And you want to take my computer? How many homeopathic remedies can you carry? The computer can carry Empire State. That's the beauty of the computer. It is an incredible tool. Incredible tool. But I thought to myself, what if I go in an area where the power is down? I've fried a circuit board in one of my computers before. I'm down. My healing is gone. Okay? I'm in the jungle. When I flew back from Reeby's meeting with him, I was flying back, and I forgot how bad it was going over there because international airline flights, everybody smokes. I almost died. We have no smoking now in California. We may be progressive, but we're pretty smart. We may be kind of crazy, but we're not stupid. And so coming on the way back, I almost died. I'm riding first class, and the smoke, in Europe, I had to go eat at 4:30 in the afternoon. I don't know if any of you go on travel there in Switzerland. In Switzerland, let me tell you, is expensive. And you go there, I eat at 4:30 and meet the crowd so that when they come in, the smoke doesn't kill you. I came back, I was on the flight back, and I realized they started lighting up as soon as you got in the air. I said, oh my God, I'm not going to make it home. I couldn't breathe, I choked up. I said, I'm not going to make it home. What am I, oh Jesus Christ, what am I going to do? You can't run a computer, by the way, on an airplane, by the way, when you're flying and all that stuff, and our cellular phones, you can't use them. So then, all of a sudden, I said, wait a minute. There must be a code to clear myself. And my particular code that time for that was 28 and 32. I didn't even have paper. I didn't have a photograph. You know what I did? Guess what I did? You're a plant. That's not fair. You're a plant. She's not supposed to be here. It's my girlfriend. She's not supposed to be here right now because she was so sick with an infection that she wasn't supposed to be here today. But anyway, the coding, she's a demonstration of the coding why she's here. But that was a plant. Yes, I took my pencil and I wrote 28 and 32 on my arm. And within, just like the heart attack recovery that we've had, in 2 to 3 minutes, I could breathe and the smoke didn't even bother me. Now, 28.
That gave you oxygen, you're saying?
No, it was affecting my nervous system in my head and nose area, affecting the circulation of the head and nose area. And I believe the other number was 32, and that had to do with 3 is lung, affecting the nerve. The smoke was blocking my circulation in the nervous system and my lung. That cleared. Those just 2 digits on me cleared it up. Okay? This was where I realized that if I'm going to go into the jungles of Ecuador or Peru, All I need is a pen and paper. I don't even need paper. I could write on my body. I'm not going to take a bath anywhere over there probably anyway, if I'm here in the jungles. I went on an Indian sun dance in Arizona this last year because I had back problems when I retired from dentistry. I had severe back problems. I went to a sun dance. There's no shower. I'm sleeping. That was one of the most brilliant things I learned. And I'm going to share this with you. Anyone has chronic back pain? Does anyone have chronic back pain here? Raise your hand. Everybody, especially dentists. Everyone has chronic back pain? Yes. I coded myself. I could take the back pain away. But I'd have back pains so bad. In fact, I had a meeting of the UN, meeting with the head legal counsel of the UN on the coding system, by the way. And I had back pain so bad that I could barely even get into the car, the limo, whatever they sent for me and everything. And it was so bad. When I went to this Indian sun dance, I had to sleep on the ground with no mattress. Okay? And I've been working on my back for 2 years to heal my back. My back was about 70% better with everything. And then I found out that when I got up the next morning, my back pain was completely gone. Completely free of back pain. And I couldn't believe this. And what I realized is I'm a side sleeper. I sleep on my hip. When you sleep on a bed, the greatest mass is in the hip region. It sinks the hips down and you create an abnormal scoliosis in the back. And that scoliotic pattern triggered for me chronic low back pain. I've never had a severe injury, but I mean so bad I couldn't even get up out of bed. It was so bad. And ever since that point in time, I get a little mattress, the little camping mattress, self-inflate from China for $35 or $70, this thick. I put a down comforter over that. I get 2 pillows, a firm pillow and a down pillow. And and that's my bed. I have a bedroll. I go through I go through Beverly Hills in my Mercedes-Benz with a bedroll in my back seat if I'm traveling. And I'll tell you something, it worked. The only thing I can remember that this working on was Jim Thorpe, a movie of Jim Thorpe. And I think, who played in that one? It was a great movie. Burt Lancaster, right. And he goes into the dormitory as a runner in the college, and they say, aren't you sleeping in bed? He says, no, and he lays his bedroll on the ground and sleeps on the hard ground. And I've given that farmer to 3 or 4 people. A lawyer friend of mine, severe back pains. So he sleeps on the floor, it's gone. Now, no chiropractor ever told me that. I went to a therapist at a chiropractor for 7-9 months. He gave me some therapies on rage, and I did release a lot of things and everything. But that was such a simple technique for back pain. Try it. It's real simple. Costs you no more than $100. And tell me and write me a personal letter if it works or doesn't work. Just try it. I'm telling you, it's amazing. So I went to the Indian sun dance to work with the Indian healers over there because I want to know how come these people are going through these amazing, amazing stress patterns of no food, no drink, or water. And I'm sure that Dr. Cuno in his travels to watch these incredibly beautiful rituals go on. And I wondered, how come there are no heart attacks? How come there's no one dying in these things? They're suspended up in the air. You know, you see that man called Horace, and there's Sundance process going on. And I asked the medicine people, anyone get a heart attack? Because I went there hoping to think I can maybe help her. No heart attacks. No one's ever died. But one woman had a diabetic problem, and she couldn't dance. And we coded her. We went into the sacred area, and we did the codes for her. They allowed us to do the codes. And she wanted to participate, and she was having some severe blood sugar problems and whatnot. And the code numbers that came up with that for diabetes, pancreatic problems are 5 and 8 and 5 and 9 as a general rule. So I'll just pick along with these as we go along. Anyway, we coded her that night. The next day, she was back dancing, and she finished the Sundance of 4 days. The medicine man and the people there knew what we were doing. They have a little shelter for people that support anything like that. And it's a wonderful technique. It does not take away from any other technique. This technique is a supportive system that works in combination with homeopathy, structural adjustments, live cell therapies. After Dr. Q now has done his wonderful work, I've coded patients to support the immune system. I'll tell you something very interesting. Dr. Q now gave me a brilliant assessment of natural killer cell activity in terms of tumor. Both my mother and father died from cancer. Okay? I lived through this process. I said, well, genetically, I'm probably at the highest risk of anybody. My dad died when I was 14. My mother died when she was 72. Dr. Cunell was so gracious to treat my mother, and his work was just brilliant because she was able to live through her cancer without morphine to the very end and in very little pain. I learned something very important from her. She chose to leave. She chose to leave. I learned something. When I work with someone who's very sick, like a cancer patient, and I do supportive work with other doctors, I first ask what is their percent will to life or will to live. If their will to life is in the 80s or 90 percentile, that means that they want to be here. I've been told that cancer is a form of social acceptable suicide. One of the brilliant men that used to go around, Klaus Pullman from Germany, first thing he would say is, do you really want to live? Okay? And I learned this from my mother, that at a certain point, she didn't want to be here, she wanted to be with my father. And at that point that I realized that, I let her go. I said, it's okay, you can leave. I'll be okay. And I learned, but Dr. Cunell's work and others that support was so beautiful because she lived 2 years longer than the medical establishment she could live. They only gave her 2 years, though she lived 4 years. Free of pain. We were able to control the pain with the coding system and other techniques. Cancer pain. You know how bad cancer pain is if you live with it? Morphine-type pain with no drugs. Complete coherency to the very end. She and I had the chance to spiritually communicate right to the end. Right to the end. And even right at the end, it was very mystical because I knew when she left the body and I heard birds singing. And they say in Buddhism, when the spirit comes, you hear the birds sing. A dear Catholic friend of mine heard my mother, heard birds singing, and she, outside her house, she said, Margaret, is that you? She went outside looking for her. It's an incredible story. I mean, these are things that if they're drugged out and you don't get a chance to have that closeness and communication, you lose something in life. Okay? This process allows you to have that communication. We use the codes to help projects. Movie projects where directors and everybody are fighting, you know, situations where mother and daughter can't communicate, childhood problems with children and parents communicating. These get into areas where we will go into at some point. But in studying primitive, what I call indigenous peoples, primitive sounds like they're lower class. In working with indigenous peoples, you'll find out that most of their shamans or healers deal with spirits and cleansing the spirits. You look at Christ's healings, many of it was cleaning and taking out the unclean spirits out of the energy fields. Those are the simple codes 8 and 9 and 9 and 8. Do you see how simple it is to clear a field? That code, if someone is violent, depressed, you use those two codes in the patterns, or even in the simple patterns of just those patterns. In a clear depression, energies, this and this, within 24 hours. So simply. You know, it was very interesting. I had a spiritual godmother who was one of the finest psychics and clairvoyants in town. I consider one of the finest. I saw multi-million-dollar deals. I saw some of those powerful people, governors of California, you name it. I mean, came in for readings. You'd be surprised. Kissinger used to, I mean, all these people, all these high people in high places, they all go see psychics. You don't even know it. Just about every president of the United States has had their own personal psychic. Did you know that? No. Did you know that? You didn't know that. Okay.
I only know about Nancy and Ronald Reagan.
Yeah. Well, yeah, they have.
Well, that and astrology also.
Yeah, that was astrology. But anyway, powerful people consult. All the kings and queens of yonder before always had their soothsayers and their wise people. They consulted. Okay? And a lot of times when I had medical conditions, I was going to go into psychiatry till I was going to USC. I was accepted to USC Medical School. I was going to go into psychiatry. I knew the dean of the USC Medical School so well that I'd go in there every week because I loved this man's mind. This man carried me 10, 25 years into the future. A brilliant, brilliant man. And I went to go into psychiatry, and he said, don't go there. They don't know what they're doing. They're just drugging people. Go into internal medicine or surgery. Do not go into psychiatry. But the human mind fascinated me. Fascinated me. I want to know what is that world that we don't know about. And I experienced it. In my journey, as I would call it, I experienced that the spirit world does exist. When you talk about Carlos Castaneda and whatnot, I know that spirits do exist. the spirit world is real and that there are spirits. And every indigenous tribe or people that you go see in their healing process deals with this area. And a lot of times when you're dealing with very sick patients, you're going to find that this spirit world energy, and I think there's a doctor friend of mine in the back here who does work with cancer patients and whatnot would understand this very well, that the spirit world is an integral part of healing when you're dealing with very sick patients and how they lose energy in that dimensional realm. So this could be cleared so easily with 8 and 9 and 9 and 8 codes. I was told by my spiritual godmother that in the later part of my, I would write a book and I'd go into the ministry. I said, after I experienced those, you know, those exorcisms like in the movie and stuff like that, that I said, thanks, but no thanks. I don't want to deal in that world. And she says, no, she says, it's not that kind of ministry. It's going to be ministering to people. And so I said, thanks, but no thanks, because I knew what it entailed. You know, it's like calling out the spirits and exorcisms. I knew people that did exorcisms, boy, their hairs turned white. I mean, they dealt with some very powerful forces. I said, thanks, but no thanks. I'd rather not. I'd rather, you know, take a vacation. What's so brilliant about this system, and I'll tell you what's so beautiful about this system, dealing in this area, is that you don't have to do battle with your adversary. You don't have to challenge and call them out and fight wars. You know what you have to do? Flick on the light switch. That's all we're doing with this system. We're flicking on the light switch.
Because evil is the absence of light.
Evil is the absence of light. You know what evil is? It's live spelled backwards. The devil is lived spelled backwards. There's only one power. There's only one power. So there's nothing bad about darkness. If we did not have the darkness in the night, you would have no rest. For creation to exist, that's why I showed you the one circle and then consciousness forming. Out of the void came the word, which is vibration. Came consciousness. The two circles came together. You have creation, male and female. The binary system. In the physical world, it's a binary system. In the spiritual world, it's a monad system. But
What?
monad, single. Okay? So what happens now is you can deal with, I've dealt with some of the most severest mental disorders just so easy, and I don't have to do battle. I don't have to do battle. Yes?
Can you just sort of, maybe I'm the only one here, I'd like to know how to do this. I mean, like...
Okay. I have to give you,
numbers? Okay.
I have to give you what the numbers represent first. Okay?
I'm really wanting to know.
She wants to know what took me 40, 50 years to disseminate over time. I will try to do this for you. You're welcome. What? I want to say one thing. I'm 51 years old. I'm going to say one thing about Dr. Q now. Dr. Q now really got me to thinking about natural killer cell activity because of my genetic predisposition with two parents having cancer. So Dr. Cunell's brilliant idea of head trauma, midbrain, hypothalamus pituitary, or viral insult to the area, blocking that, what we call the neural reflex loop to immunity to the bone area, to the natural killer cell activity, got me to think there was a brilliant researcher by the name, what's his name in UCLA? Donna? Dr. Gonium. Wonderful, wonderful soul at UCLA's research center. Tests a lot of natural remedies and developed a natural killer cell test. This is what I'd love to do with, and put he and Dr. Cunell together when we have some research funds to show that Dr. Cunell's work actually can stimulate natural killer cell activity directly with a blood test. And if you're interested in this, we can get you his number. At some point you can contact him. I sent a lot of my patients down there because a lot of the medication natural remedies that he tests are free. Once you qualify, you have the natural killer cell activity normal is about 50 and above is normal. Usually the range of normal is about 50 or in that range above is normal natural killer cell for protective, because we are producing cancer cells all the time. We just have the natural killer cells to take care of them. I sent all these patients to make 20 patients. One time the lab technician and Dr. Goodham said, why don't you take the test? I never thought about it. You know, I mean, I said, okay, I'll take the test. I took the test. They came back and said, my test was the highest score that they had. They only have one score like that a year. Maybe it's, I think I raised it at 82 on my natural killer cell activity. I think the only other person that had it was a nurse that was in there. They maybe see one of those a year. I said, what are you doing? I said, if I told you, you wouldn't believe me. Because I don't take my vitamins religiously. So I said, But anyway, in that area, I wanted to share with you that, how we learn from different colleagues, and then we take that information, we build upon it. It's so important. Let me go into now the actual application and how we do this now.
And before you get going, besides Dr. being in dentistry, I'm so exact.
Yes.
Besides writing on your body, now you're going to take these numbers
Yes.
and do you place them certain places on the body, or does it matter?
Doesn't matter.
Basic question.
Just on the energy field. You have a field just on the physical body itself. In fact, I've even gone by San Onofre and done this because when you go by San Onofre, you get exposed to radiation, and Dr. Q now knows this. This man is so smart back here. I can't believe it, because when I started monitoring my patients, they're doing live cells, and they'd come back, and I said, they're losing about 20 to 25% of the efficacy of the live cells when they drive by San Onofre, because radiation in the first 2 days, when you get live cell therapy, you have to stay away from sunlight, hot showers, and digestive enzymes. Correct, Dr. Cuno? Yes. And so what happened was that I started seeing that the efficacy was dropping when they're driving by San Onofre. And I monitored San Onofre, because when you learn to dials, you can say, well, when was my radiation toxicity? And it starts going from 10%, 20%, 30%. As you go by San Onofre, it's 99%.
Where is that?
San Onofre is a nuclear reactor site. Most of these reactor sites are all leaking, by the way, and I'm going to go into this pretty soon, because radiation is a key toxin in the world right now. So anyway, what I want to go into right now is I want to go into now taking some of the numbers itself and showing you how we put them together, okay? Okay, the next sheet. These are some of the parameters that are baseline parameters if I'm measuring somebody, and these are some of the key areas for a short and concise method of evaluating a patient. If you just need to do a quick, and I call down and dirty evaluation. And I do this, you can use this with muscle testing, you can use this with Vega testing, you can do this with any kind of biofeedback system that communicates with the body. You ask what the geopathic stress low level is, because every case of chronic disease, geopathic stress can play a major component of preventing the person from getting well, no matter what you do. You need to either dials that out or muscle test it or find some way of distortion. The coating can balance out geopathic stress just like the coils did for the trees and whatnot, so you can use that, but it's better to find a safe zone to sleep in. The second thing is take a vital life force reading. Yes?
This stuff, what you're checking now is on a percent scale?
You can use a percent, whatever scale you want to use.
You look for the number when you're checking out?
Yeah, yeah.
3, 4, 5, 6, 7, 8, 9, 0.
Yeah, if you want to do a 1 to 10 scale, I use a percentage of 1 to 100 or 1 to 99, basically. I have in my mind, Dr. Vaughn, when we did hand-to-hand testing, your balance is like the number was average balance rate is between 80 and 84, I think, is on EAV, skin conductance measurement. That kind of sticks in my mind. I've had some super athletes that have 94% efficiency rates on their organs, but they're super athletes, okay? But I would say that, and one of the things that, okay, so I take a vital life force reading to see where they are. The patient that had the headache, how are you doing? 50 or 60% better? Good. Okay. We didn't take any needles. You took no drugs, no medication. Sometimes it takes, because you're on 10-digit codes, it'll take us to tomorrow and then one more coding tomorrow. So follow me through. Catch me tomorrow. And we'll do another coding on you tomorrow. So 50% better in what? A couple of hours? Is it bearable now a little bit? I mean, so you're learning something now. You don't have to, I mean, you were in distress, correct? Right before we did that? Okay. So 50% better is about what I expect, because we're going to code her one more time to go out, and then we'll clear it completely. Now, where is Dr. Gleditch? Is he still here? No, because he was treating a patient here, and I know, he's really, I mean, his energy was, he was the lowest of all of us here. You have to honor that man for sharing knowledge, because he did it in spite of what his body said he could do, because he was on a 9 vital life force. Can you imagine? He was running on fumes. Okay, vital life force. The next one that I feel is so critical is radiation stress. Radiation stress, and you have a sheet in there to antidote radiation stress. The code numbers are 3 and 8 for direct radiation, 8 and 3 for past radiation, 3 and 7 and 3, and then what I call the thyroid codes, which are 79, 79, 79, 8. No, it's in your chart. You have it in there. It's in there. You have it. That would depend on what organ it's affecting or something like that. It's not specific. There's no specific code for geopathic stress. Yes, Lee? What? If you're getting radiated right now, you're going to need the 3-8 pattern. If you're getting an X-ray right now, if you've had the X-ray or you've been radiated, it'll be 8-3. That's past radiation stress.
What is 3-7 and 7-3 and then?
That is basically circulation for the liver, gallbladder, meridian. Gallbladder really is what the gallbladder meridian is the largest meridian that traverses the whole body.
And then you said 7-9 and what else?
Well, 7-3 and 3-7 is another pattern. That is for kidney and liver gallbladder.
And then 7-9.
And then the 7-9-7-9-7-9 pattern and 9-7-9-7 and 7-8-7-8-7-8-7-8 and 8-7-8-7. There's a sheet there that says there's some radiation codes. Pull that radiation sheet code out. It's in there. Look at it. Let's see if I have it here. I made these so you can Xerox copy these off and cut them out and put them on your photograph or put them on your body. You have these little, where's these little? No, that's not, that's something else. No, the radiation codes are numbers. It says at the top, there's one for devices. You see them? Okay, wait a minute. Let me just go through my summary because I have them structured in order. I'll get into that area. Let me just go over there. Let me just finish. Let me stay on track and then we'll get to it, okay? The next one that's important is mercury heavy metal stress percentage. Okay, because that interferes with so many functions. The next slide is thyroid immune efficiency. What I found very interesting, and this goes back to Broda Barnes' work, I found a direct correlation between thyroid efficiency and immune efficiency. They're one and the same. And I found across the board, so many patients have a depressed thyroid function. 20%, 4%, 10%, they should be resonating. A low efficiency thyroid should be 50 or 60%. A healthy one should be in the 70s somewhere.
80 to 90%
Exactly. And heart disease patients too. If you look at Broda Barnes' work, heart disease, cancer, and infections, lung infections, bronchitis, chronic infections, all low thyroid function. Because why? Because the thyroid function is basically heat production. That's the thermostat of your body. And if the body heat is a certain range, it's resonating also in a certain frequency range, bacteria, viruses, parasites, and fungus don't function well in that range. That's a healthy 98.6 body temperature. But the basal temperature test using a digital thermometer is the easiest way. They got these digital thermometers now. They only take a minute to do. Stick it on your arm, minute, and it stores the memory so you can go back and sleep if you want to. You have to do it when you first wake up in the morning. Get anyone of Broda Barnes' work or Stephen Langer, I think, called Solve the Riddle of Illness, or Broda Barnes' work on hypothyroidism.
But I thought they didn't want a digital.
Right. They're designed to measure fever, and if you have fever...
Digital basal temperature thermometer, a digital basal temperature
Basal.
by Becton Dickerson. Yeah, just check to see if there's a correlation. I've done that. I get both a mercury and a digital. Mercury is about $4.50, digital is about $9 to $14. Most important way of measuring your immune, the most simplest way of measuring your immune system. You got that reading in the normal ranges, hey, you got a healthy, my reading is, my thyroid efficiency is about 76. My basal temperature is maybe 97.8. It should be between 97.8 and 98.2 is the normal ranges. Anything below is subnormal. And you know, 97.8 to 98.2. You know what knocks out thyroid? Mercury. You know what knocks out thyroid? Radiation. Those two, mercury and radiation. Chemical poisoning and viruses also can knock out thyroid too. Electromagnet, well, that's radiation. That's part of radiation. Yeah, electromagnetics would knock out thyroid. So check every one of your patients for thyroid efficiency. It's so simple to test. If it's low, then you know you've got a problem with the immune system. You can run a natural killer cell test if you want to, but why not just take the direct route? Next one that you do is, I got basal temperature there, and then you can go down, and the 4 major bacterial levels are parasitic, viral, fungus, and bacterial. You can get readings on those. Got a friend of mine called me the other day, says, I know I got a viral infection, I know I got hit by radiation. Let me tell you something what happens when you get hit by radiation, because we had a patient here And where is she? The one that had the ear infection. Is she here? Is she gone? Okay, there's a woman that came with a doctor, an assistant. I guess they're real tired. And she came in and she had infection, pain so strong that she was excruciating. I did the codes on her, and what came out was she'd been radiation poisoned from flying on the airplane. When you fly by airplanes, I'll tell you about radiation, you get hit when you fly on an airplane, badly. You get hit now by even being alive, but I mean flying an airplane and you really get hit. That's why the average lifespan of a commercial pilot is 5 years shorter than the average lifespan of the male counterpart. Dentists also have that same 5 years shorter lifespan. Okay? So when you take that factor of the radiation affecting thyroid function, affecting this, and it also affects the reproductive system also. Because the two most sensitive tissues, why in dentistry we cover? Reproductive and thyroid. Thyroid shield, why? Because those are the most sensitive to radiation. Okay, so that, when you get radiation poison, the two symptoms that you classically are sore throat, which she had, and tired and fatigue, like someone pulled an energy plug on you. Okay? What goes up significantly when you get radiation poison? Parasitic activity and virus. Always shoots, one or the other or both. And then sometimes bacterial infection will go right up with it too. So this woman came in, one of the people at the next seminar, and she had a bacterial infection triggered by radiation poisoning. And the code numbers for bacterial infection are 5 and 7, 7 and 5, and 5 and 8, and 8 and 5. That's how I treat all the dental infections, dental foci, whatever you want to treat. Yeah, okay. The last one down here is chemical, pesticide, drug stress. Again, that affects. The next point that's really important is hydrochloric acid digestive disturbances. Because if you have and don't have a complete, what I call your second shield down here, which is your hydrochloric acid, then you allow parasites, bacteria, and viruses, everything go right directly in the system. Okay? That's part. When I sat down with Dr. Schimmel there about 10 years ago, we sat down, we were both like two little kids because he was showing his bacteria and I was showing him mine. We had lactobacillus. He had one that was $100 a ball, mine was 125. So I beat him, he said he would never travel the world without carrying his acidophilus culture with him because otherwise he couldn't travel around the world and eat all the foods that he did. Your digestive system is 60% of your immunity. Your gastrodigestive tract is 60% of your immunity. The thyroid is tied into the large intestine. In the classical vole system, it's tied into stomach, spleen, pancreas. But in the classical oriental medicine, it's tied into the large intestines. You have a blowout in the large intestine, and you have thyroid problems. What? I can hear you. Okay.
So if you're going to fly, you have one of those little things.
And then you can use radiation codes too. This protects you from low-level radiation. If you get really hit, you got to do codes too. Because, I mean, this basically uses computer, electronics, things like that. But it really does help also, because if you eliminate the radiation, you help the thyroid, you help all the other organ systems too. Sometimes you need to do combination techniques and things like that. You can't do just everything with energy. Okay.
Take a break real quick here.
You want to yeah, okay.
Take a quick break.
All right, do you want to? I mean,
Where do we get the...
if you want to take a break and go out, okay? But let's go, because I got to run through these.
Get the radiation shield...
Codes. Yeah, a patient of mine back here, Norma has them over here. There's a little packet set up here for $5, and it has a little string and everything, and it has something you can stick on the computers. You can stick it onto your just on the front of the television, on the back, your cellular television. Put it right where the battery is, the lower part of the battery. You can muscle test this or dials it out, and you'll find that it shields you from the radiation stress. So they're there. She printed them up for us, and whatever she did to do it, it just cover the costs on that. It was really hard to do because they couldn't reduce it. They had to use some special technique because they couldn't reduce it because the imaging didn't come out real well by just taking it down. So she did a special technique. Okay. Now let's go to some of the codes, another area of the code application and their meaning. Now, do you see these numbers right here? The 32, 34, 36, and 44. If you want to learn anything in the course at all, anytime you want to balance the energy system ball, you just put those 4 numbers on your photograph, and then add any of the other 2-digit numbers. Like for radiation, it'll be 38 and 83 and 37 and 73. You can just put those These 4 numbers combined with 4 other numbers, and that was what Dr. Reeby did in his last 4 years of his life. I'm just giving you this guide so that if you want to do something right now, you can take a photograph of yourself or take that little thing, if you, the little packet that you have, you can stick the codes right on the body, wear it tomorrow if you want to, just by looking at what the symptoms are and putting them on there and give us some feedback. But this code right here, if you feel the pulses, sometimes will balance the acupuncture meridians miraculously. Now there's a problem with this system, and he told me about this. If the person wears any metal on their body, rings, watches, eyeglasses, or anything that's round that's a circle, it throws off this patterning. So when you go to sleep at night, you can put this coat on when you sleep at night, just take off all your jewelry and everything that you wear so the body's in that. No rubber bands in the hair, and no women's bras contain a little O-ring right up here. It throws it off. When I was first doing this work with Dr. Reeby's work, this was the only problem with it. People would wear even jeans, belt buckle jeans with has a little ring in there like that they put in there. It throws this patterning off. That's why I had to go to the longer digits so that you could wear whatever you want and immediately balance no matter what they're wearing. Yes, Stephen?
Just take a photo of yourself with no clothes on, put it on the photo, and it doesn't matter what it is.
No, the photo just keeps your energy field. If you're wearing a ring, that ring interferes with this particular. The 2-digit coding patterns, the binary system is form field affected. Form field means if you put a ring or some kind of round thing in it, you can test this out. If you muscle test, put it on, feel the pulses if you can, or muscle test it, and you'll see it balance, and then you take it off and you're weak again. But this pattern is called this universal balancing pattern. This is culmination of 50 years of a man's work. It's these 4 numbers right here. Can you imagine 4 numbers, 50 years of what he evolved to? I had to put this on there. I cut this in 4 sections so you can cut these out and put them on members of your family, children, or whatever you want to do, just to put them on. Maybe put them on when you sleep at nighttime. He said you can leave them on 24 hours a day, ad infinitum.
You can just write them out, though.
You can just write them out, yes, you can just write them out.
Put them on tape.
Yeah, you can put them on tape. I just get a little stick-em tape like this, and just tape the corners down on the kitty corners. Okay? Now we're done with something that you can do. This is something that you can do right now when you go home. When you fly, if you're flying and get radiation, or you get tired, sore throat, put the radiation codes on, the 38 and 83. If you go by San Onofre, Dr. Q now, put the radiation codes on. You put them right on your body or whatever you want to, and just leave them on for a day or 2 days. 24 hours usually is enough to balance you out. Yes?
Gotta be clear to people, Vaughn,
Yes.
that no matter when you take the picture, the way you are now is reflected on that picture.
Yes. Yes.
Anytime.
Yes.
But you did the picture on those people, and maybe they were wearing circles, no?
No, but this system that I did is an advanced system. It's an evolution of Dr. Reeby. I'm taking you through the process of evolution. What I did, Dr. Reeby's system would not work as fast. It may work as fast. I just moved on very quickly because when he went over the other side, he said to me, "Oh my God, when I'm no longer in a 3-dimensional body, look you can do this, this, and this. My God, there's all these possibilities." I was limited by my 3-dimensional mode. And we went out of that 3-dimensional mode, and he shared his knowledge. I knew that it came. I can't take credit for all this. It was brought through his spirit, and I dedicate actually this seminar to his name on this. Yes, Lee.
Is it 32, 34, 36, 44 pattern that would be affected by the rings, or is it?
Yes. Any 2-digit patterns affected by rings are not. The larger patterns are not. That's why I went to the larger patterns, because I found out that when I'm working with surgeries and patients like that, they're wearing glasses. Anytime there's a ring around the glass, it threw it off. I had a woman, she had no clothes on her. She had just a little jogging suit, tank shirt, and tennis shoes, and I couldn't balance her. I couldn't figure it out. And on the heel of her shoe was one of these high-tech tennis shoes that had a little ring embedded in a clear box in the heel. I said, "Something's wrong. Take your shoe off." It was almost like strip poker. Finally, I got her balanced out, and I looked at her shoe, and she had a little ring embedded inside the tennis shoe. And then jeans.
What about the eyelets in where shoelaces go through it?
Yes, that will also do it too. Eyelets will also do it too.
They talk about, say, wedding rings or so forth that you've worn for years and years.
Yes, well, this is a problem because Reeby found that when he was penduluming the patients, any kind of metal on the body created a negative spin. This is what we found in electrogalvanics with dentistry. Any metals on the body create an electromagnetic spin pattern. So he said take all metals off the body.
How about gold cup?
Yeah. There's a problem there, isn't there? Because you can't take those off so easily. Yes.
Is there any way to
Yes.
correct the
Yes, there is ways, because it distorts an organ energy field where the gold crown is off. It's on an upper first mole, that's stomach, spleen, pancreas. And what happens is you can code that and balance out the stomach, spleen, pancreas. Okay? Yeah. Okay, now, let me give you some of the patterns here. The single digits, if you use this, are tie into the brain and head arena. So I had several patients that I had a patient with a 7 code number that showed up. Even on the long strings that I use, sometimes I use single digits. A 7 showed up, that means mental fear. If 3 shows up, that means anger in the mental. Okay? 5 shows up, it means blocked happiness in the mental.
Why do these things show up?
Because when I'm dowsing these numbers, yeah, muscle test, you get a feedback from the patient.
Why don't you give us 2 minutes on how to dowse with that?
This is a back scratcher.
That other one that you were running.
I can't give you a 2-minute discourse. It took me I took 25 of my patients to teach them how to dowse. I didn't think I could do it. I did do it, but it took me about 2 days for them to get it. It's an aha experience. It's like in teaching electroacupuncture when you find the point testing. One day you just get it and you know you got it. It's that type of sensation.
How do you do it with kinesiology?
Kinesiology, you can muscle test and ask, is it the first number 7, 1, 2, 3, 4, and then it'll go down. 5 is the number you want. What's the second one? 1, 2, 3, 4. 7 is the second number. And then you put it on in therapy, localize the area. If you got the right numbers on, it'll test strong. That's how you do it kinesiologically. Does anyone understand that?
Sometimes if you buy a pendulum, it'll have an instruction thing with it, and then you just practice.
Yeah, it's just a matter of intuitive feel. I call it the aha experience. Once you get the aha experience, you know. Yes?
So for the first number, you're looking for a single-digit number?
No. I'm just saying that we're going to start on basic primers, so you can go home and do some of this work right now. If someone's really angry and they're ticked off, you can put the number 7 because that's an anger code, and then you put the emotional pattern of 9, 8, and 8, 9. If you have a husband or spouse that's just going off crazy and berserk,
7 was anger.
what? 3 is anger. Excuse me. Yeah, I'm talking about fear, anxiety, fear. Yes.
I have a real basic question. What is the energy that these numbers are imbued with? In other words, I write an 8 or a 7 or a 9 on my arm.
Yes.
To me, that's ink.
Yes.
Obviously, it's having significantly more effect.
If I wrote the number 1/0000000 in your checking account, do you think you'd be a little bit different? Feel a little bit different?
That ink, it's symbolic of
Yes.
something more powerful.
Yes.
When
That's what exactly this is, symbolic of something more powerful.
Right, but what is that energy?
I explained it to you. Light, frequency, electromagnetics. Numbers are living, vibrating energy beings, just like you are a living, vibrating energy being. People base so many of their lives on astrology, for example, which are numerical conduits for your expression in this particular dimension. Does that? It's a representation of light, frequency, information. If I can give you in a concise shell.
It's just that there would have to be a certain intentionality to draw that light onto a pattern of ink.
If I flick the light switch on, do you have to know the intentionality behind that? The light just goes on. It's just a simple.
Right, but there's a very simple wiring that causes it to go on.
Well,
Whereas
we have electromagnetic wiring that causes things to go on if you believe in electromagnetic field spectrums in the body and whatnot. Does that make sense? There's another type of wiring besides physical wiring, which you call electromagnetic or light transference or whatever you want.
Push the button on the remote for the TV.
Okay, now, I got to go over an important area for you because a lot of healing conditions are not just physical. A lot of healing conditions involve mental, emotional, subconscious, preconscious, past conscious, miasmatic. These are these code patterns here, the zeros. The zeros, when the zeros came in, the mathematical reality, I can't remember when it was, but I'm trying to think, does anyone know the history of mathematics? I was reading it. Very fascinating because before that time, the Romans had no zeros. So the zero created a significant change in man's consciousness. And this is what I've been able to ascertain from this. This is why I couldn't give this class, because I didn't know what all the numbers meant. It took me 6 years or 5 years to discern what the numbers mean. The zeros, starting first, and the 2 have to do with unconscious, subconscious patternings of stress. The 1 and then the 0 has to do with pre-conscious stress patterns, past life or miasmatic. We call it karmic memory patterns or something like that, if you want to believe this. A lot of the 2 or 3 of the patients today had past life karmic memory stress that this pain was triggering. Maybe a shoulder pain might have been a past life where another time in a lifetime they were maybe struck or crushed in their shoulder. I did a significant healing for a woman, for example, one time, who many women, and I talked to a lot of therapists on this, have had sexual abuse problems. I was dealing through the tooth with a patient. Through a tooth, it was the upper bicuspid molar, and it came out sexual abuse as one of her key traumas. And I found, and I don't know how I got this, but I said, were you a sexual abuse case? She said, yes. She said, in fact, I've been in therapy for 7 years, and my father sexually abused me. And she carried so much anger from this. So we did a coding on there. One of the codings that came up was karmic past life memory stress. So I told her something very simple. I said, let me tell you something. And this is how healing occurs. I learned this from the Native American healers, completing the medicine wheel. This is how true healing occurs. I said, let me tell you something. The reason why you had to experience being molested as a child and you thought you were a victim because in another lifetime you were the molester to a child. And you had to come into this embodiment to be on the receiving end and know what it feels like. And at that moment she burst into total tears and for the first time was able to forgive her father. And Christ says, forgive. But you forgive, but you don't realize that true forgiveness occurs by completing the medicine wheel of the circle. Knowing both sides and experiencing both sides. I carried tremendous anger down in my lower pelvic area called primal rage that a very dear healer, brilliant healer, led me to, and I went through an Indian medicine journey, and I was a bear in another lifetime, and I was struck by an arrow by a very famous Indian medicine man chief, and I had so much rage and anger. How could the greatest powerful creature being of a bear in the North American continent be killed by a puny human? Impossible. And I died in that anger. And when I was carried through the journey, and I saw, that's where I stopped at. I carried this rage, and I carried the journey into the medicine journey and saw the other side of the wheel, and I saw this medicine man praying over my body. I saw my robe being used to house the child and his baby. It was the winter. This was the last kill. If he didn't make this kill, his child, newborn child and his wife would have died. They wouldn't have made the winter. It was a harsh winter. And that process of then sacrificing my life, I saw that my life by giving up, he honored my soul by giving my name to his child. And I completed that medicine journey, and I forgave for the first time my anger and rage, primal anger and rage that I carried. Back pain. Though right here, pelvic area. Number 3, pattern. And that's what I'm saying, that healing requires that total process of the wheel, of the circle. And we go back to that first diagram of the circle and the wheel. A very important aspect of understanding. And the 0.
Excuse me.
Yes.
When you're taking a patient,
Yes.
and you're gonna muscle test them, say, this is, what's your first number? Okay, it's anger, it's 3. What's your second number? Then you're going, is it 1, 2, 3, 4, 5, 6?
What I would do first is I'd take the first base, like 4 numbers there, and put it on it, make sure they have no coils on the body. Yeah, those numbers there, because those are baseline balancing patterns. And then ask, numbers to use. And usually they use 4 patterns, like 4 slots you can fill in. I've sometimes added 5. Sometimes I've added a single-digit 8 as the 5th pattern to the 2-digit 4 patterns on there. In this simply add an 8 to it. When I want to do a quick and dirty or down and dirty code, I do the short system because it takes us fast. Yes.
You add 4 more 2-digit codes?
Yes.
Get these
If you want to do 3, yeah. He always said to do 4. I found that sometimes you can add a 5th. You can sneak an 8 in there, which opens up the circulation to the head area because they're blocking out mentally. Yes.
There's one, I got a question I hope applies here. I have a dentist friend that's going to have a shoulder operated on next Thursday.
Yes.
How am I going to put some numbers together for this guy?
Okay. One of the things that you want to do whenever anyone goes under general anesthesia or anesthesia.
Maybe he won't have to have a shoulder operation.
One of the things you have to do, and let me reiterate this in all healing areas, you cannot do any healing area unless you have permission. Yeah. There's an unwritten rule on that in the spiritual healing area that the person has to give you permission to grant them to do a healing. The one area that you do not have to ask this on is the 8 and 9 and 9 and 8. Because if that energy is in that person, it's not the real person anyway. That's a spirit possession or a possession. You can clear that field. Whenever it goes under surgery, always use the 8 and 9 and 9 8 when they go into general anesthesia. Or if they go into an area where, there's a lot of what I call spiritual distress or spirit distress.
Well, assuming he says, okay, Bill, give me some numbers, what am I going to do?
Put the basic balancing codes on,
Okay.
and then I would use chemical entity. Like the ones for chemical entities, for chemical poisoning are liver 3 and 6, 6 and 3. Kidney chemical entity was a 7 and 6 and 6 and 7. Those are the two main organs that get knocked out by general anesthesia or any kind of chemical or drug toxicity. The liver and the kidneys have to be cleared. And then also I would put on 8 and 9 and 9 and 8. Because they're wide open. Their auric field is wide open when they go under general anesthesia. And I've had people that have gone through major possessions just by